Okay, sorry, my mouse has been finicky. So in this presentation, I'll talk about two primary ways that CHI Memorial reaches and serves the urban underserved. The first way is through their community health clinic in Hickston, and the second is through mobile screenings for mammograms and lung CT scans, which serve the community with increased access to screenings for breast and lung cancer. So the overall vision of CHI Memorial is to transform healthcare to achieve optimal health and well-being for those individuals and communities that we serve, especially those who are poor and vulnerable. And then the goal of the CHI Memorial Community Health Clinic is to extend that ministry of CHI to the urban underserved. So where are we? The Community Health Clinic is located in Highland Plaza, which is a shopping or retail center that's along the corner of Ashland Terrace and Hickson Pike. So our physical address is 3905 Hickson Pike. We are in Suite 103, which is at the corner with that Walmart neighborhood market next to the Arby's. And then our phone number there for those wishing to make an appointment is 423-756-1506. So that's our contact. So now that you know where we are, let's talk about who we serve. Our clinic provides care for the urban underserved by treating all without regard for economic or insurance status. And this involves caring for a vulnerable population of patients, as a large proportion of our patients are either uninsured or underinsured. So those underinsured patients that might fall in a gap or their health insurance does not cover the cost of their health care. If patients are uninsured, however, they do need to reside in Hamilton County, as much of our assistance for these patients is through the project access and networks that rely on them being a Hamilton County residents. So many of our patients often hear of our clinic, unfortunately, when they're referred to us from a local emergency department, and it's found that they are without a primary care provider, although a technical referral is not needed. So again, no insurance is required to seek care within the community health clinic. So who are we? A little bit more about us is we're a clinic that's managed by a team of 4 nurse practitioners and 1 collaborating physician who provide care for our patients. We also have a licensed social worker that helps to connect patients to other resources based on those social determinants of health, such as inadequate finances, living conditions, and they often help with crisis intervention as necessary as well. We have a health coach who can help with our patients with diabetes, hypertension, and obesity. And then one way she helps with that as well, she can provide follow-up on elevated blood pressure readings. Then we have a lab and radiology technician who can provide lab and limited x-ray services within our clinic. We're also fortunate to have 2 Spanish-speaking team members who can assist with translation as needed, as well as a financial counselor and pharmacy assistance coordinator who can help connect patients to pharmacy assistance programs for their medications, which is often needed. And she also helps with project access enrollment. But overall, we provide primary health care for older teens through adults. We don't, that's one thing, we don't treat pediatrics in our clinic, but we do provide primary health care for older teens and adults. And often this includes well woman exams for someone that does not have an OB/GYN or wishes to keep all their care at the clinic, provides physicals and screenings. So as I just discussed in terms of our team, our clinic resources include financial assistance, prescription assistance, social services, referral coordination, health coaching, and then we also have a comfort closet with limited resources that is supported by donations. And this closet contains items such as clothing, winter outerwear or gear, and hygiene or incontinence supplies. so we can provide that for patients when needed. As far as how to get to us, our clinic often has bus vouchers to assist with transportation to and from the clinic for those needing that, and a limited supply of gas cards for those needing assistance who have completed the financial assistance paperwork. And then Highland Plaza is on the Carta bus route number 16, which makes it accessible to many living within the city. We won't discuss much about Project Access since we had a wonderful presentation and overview of that from Ray Bond earlier today. But I did want to say that our providers are good about connecting our uninsured and underinsured to patients to specialists through the Project Access program, and just have that website here for you to have that information regarding patient application, program contact. It gives information on patient eligibility, which we discussed, and that email is here for you as well. So we've talked about our and who we are, but let's talk about why we are needed, and more specifically, why free care is necessary. I know that this number was presented in Ray Bond's presentation, but here are some numbers for Hamilton County from 2017. Is that over 32,000 Hamilton County residents, or roughly 9%, remained uninsured, and 17% of Hamilton County residents live below poverty. And as Ray mentioned, there is that TennCare coverage gap where those are patients might be ineligible for TennCare, but without affordable health insurance options. So free care is necessary in order to increase access to care that would otherwise be unavailable. And that access to care is important for health promotion and disease prevention. So we serve the uninsured, but we also treat a large number, as I said, of underinsured patients who might have insurance, but often have high deductibles and out-of-pocket expenses, which we talked about, relative to their incomes, making healthcare cost prohibitive. And as I said, a big barrier to access is lack of health insurance. So contrary to conventional wisdom, the uninsured use the emergency department less than those on Medicaid, but more than privately insured. However, while the uninsured don't use the ER more, they utilize other care less, such as outpatient care. And they do use the ER for a larger proportion of their care than the insured do. So overall, insurance increases access to and use of healthcare. In a study by Zhu et al. In 2017, they found that the uninsured tend to be sicker and delay seeking care. So they tend to seek outpatient and inpatient hospital care less. And a community needs assessment revealed that affordability and access are major issues. So by providing free care and caring for those without insurance, we help to bridge the gap and remove the barriers to seeking health care. The Community Health Needs Assessment from 2019 analyzed quantitative and qualitative data to determine some of the healthcare needs and priorities for this area of Tennessee. And they were able to identify health status measurements that needed improvement. And these are some of the 8 key findings from the assessment. Was that poverty and jobs were a major issue, access being the number 2 issue, obesity, education or personal responsibility, child health, mental health, chronic disease, and substance abuse. So in looking at the quantitative data, they analyzed health status and looked at things such as causes of death, household income, medical expenditures, smoking status or obesity, as well as education level. And Hamilton County was found to be one of the most underserved in the area. When looking at the qualitative data, they looked at data from surveys, focus groups, and interviews, and they did find a set of themes emerged, and overall found that there was a need for a culture of health within the community organizations that foster a commitment to improved health. And they found that there was a direct relationship between health and affluence, or education and income, and that those with the lowest education and income were associated with poorer health outcomes. So they found that there was a need for partnerships within the community with resources to impact community health. And our counties do have assets, which we've mentioned a little bit of those already in this conference so far, for health improvement as well. And the community health clinic is definitely a vital community asset that helps to meet those needs in our community. In addition to healthcare, other types of assistance that our clinic provides include food bank coupons to assist with nutrition for impoverished patients as well. And those food vouchers are based on income and number of members in one's household and give them access to food through the Chattanooga Food Bank. This provides those in need with up to 2 boxes of food per month. We're also often able, as I mentioned, to get the bus vouchers and gift cards to assist with transportation to and from the clinic. And then for those in Hamilton County that complete the financial assistance forms, they can receive free health care in our clinic based on financial eligibility, which, as Ray Bond mentioned, we follow the same poverty guidelines. So those receiving free health care in our clinic are those falling at or below the 150% poverty level based on their income and number of members in their household. So they not only receive healthcare in our clinic, but we also can provide assistance with like a utility bill, and they would qualify for that once a year based on their financial need. Not only does our community health clinic help increase access and serve the underserved in our community, but mobile screenings also help reach those with poor access to healthcare. CHI offers mobile mammograms through the Mary Ellen Locher Breast Center and low-dose lung CT scans. So in response to the community health needs assessment, CHI is working to expand mobile screening program by increasing the number of screenings for the indigent and underserved patients and enlarging the geographic area that is covered by those services. So why do we need to increase access to mammograms? Well, breast cancer affects 1 in 8 women. According to the American Cancer Society, 1 in 8 will develop breast cancer in their lifetime. And the Mary Ellen Locher Breast Center has 2 mobile buses that serve the community by providing mammograms. With the prevalence of breast cancer, it's also important to address the barriers to screenings, which include misconceptions regarding screening, a lack of awareness regarding the importance of screening. There might be emotional barriers such as fear and anxiety regarding screening, or a lack of understanding regarding the actual procedure for screening. There are often lack of education involved, or a lack of awareness regarding maybe a genetic predisposition to certain cancers. Lack of knowledge of importance of screening can be overcome with programs to educate and increase awareness, such as with community health fairs. And those health fairs are good for distributing educational material and educating women on how to perform self-breast exams, because education can emphasize the importance of the combination of a self-breast exam along with annual screening mammograms. And then women need to be educated on the importance of a baseline at age 35 and annual mammograms beginning at 40, unless there's a family history which might indicate earlier screening. So these mobile units serve over 22 counties in Southeast Tennessee, North Alabama, and North Georgia. It's a very busy program. It's on the road 4 to 6 days a week, making 1 to 2 stops a day. You can find their mobile outreach schedule online. It includes area locations such as schools, churches, volunteers in medicine, health departments, and the Homeless Health Center. You're also able to call 495-4040 to schedule an appointment. and it is covered for eligible women 35 years of age or over. So there's financial assistance for those without insurance or those that are underinsured and can't afford the copay or deductible. In 2019 alone, 4,340 mammograms were performed on the mobile units. And in the year 2019, throughout all of the Mary Ellen Locher breast centers, there were 387 positive breast cancer findings. 8 of those were found on the mobile coach. So there's no charge for the uninsured, and this is made possible through grants and donors. Funding for the care actually continues through the tissue diagnosis or biopsy. And then upon diagnosis of a malignancy or breast cancer diagnosis, social services assist with finding programs to help cover that treatment. So the only requirement is that the woman must be 35 years or older. And they also connect women to the Tennessee Breast and Cervical Screening Program, which is a state-funded program. And there are eligibility criteria for that. They must be a Tennessee resident, and their income must fall at or below the 250% poverty level. So it can be significantly higher than what we talked about for Project Access or free healthcare in our clinic. But they're either uninsured, so without Medicare, private insurance, or TennCare, or underinsured if they're without coverage for cervical or breast screening, or without coverage for diagnosis and treatment of breast or cervical cancer. However, the services for Alabama and Georgia uninsured do rely on donor or grant funding, but if they're a Tennessee resident, they do try to connect women to that screening program for coverage. In summary, mobile mammography targets communities that lack access to healthcare. And by bringing these mobile buses to those in underserved areas within the community, mobile mammography can help to eliminate transportation and access barriers. Mobile mammography reflects the community, church, and area employer support of the culture of health. In addition to mobile mammograms, CHI Memorial offers mobile lung CTs through the Breathe Easy Lung Screening Coach, which began operating in 2015. These are low-dose lung CT scans, which can detect lung cancer in the earliest stages. So it successfully screens for lung cancer, increases access to important screening in the community, and allows for the earlier detection before symptoms begin. So before a patient might have a cough, shortness of breath, chest pain, voice change, or blood tinged sputum, the scan can detect it, which then improves survival by 20% with this earlier detection in comparison to traditional X-ray. Private insurance coverage is available for the high-risk patient population, and there's also Medicare and Medicaid coverage. But as far as who qualifies for this, those who are 50 or over, so it's typically the 50 to 80-year-old who is a current or former smoker. So smokers who have quit within the past 15 years, and those that have a 20-year smoking history of 1 pack per day or more. So that would be a 20-pack year history for those familiar with that. Or those that are high risk with the family history of cancer or exposure to certain carcinogenic agents that are associated with lung cancer. But the Breathe Easy Coach serves 11 counties in Tennessee, 8 in North Georgia, and 2 in Northeast Alabama. It's supported by 2 anonymous donors and an EPB partnership. And to register, you can call 423-495-LUNG. But the mobile coach has open screening days in the urban community and events similar to the mammogram buses. And it is also posted on CHI Memorial's webpage under services. It's the Buzz Staniford Lung Center. So why is lung screening important? Well, in Tennessee, 1 person dies of lung cancer every 2 hours. In the early stages, like we mentioned, of lung cancer are asymptomatic. So the patient is without any symptoms and they might not have that cough or shortness of breath to know they need the screening. And as we said, treatment is simpler with increased success for cure when it's found in the earlier stages of diagnosis. This mobile lung CT coach reaches both the rural and urban underserved lacking access. It's also a very quick scanning process, only taking 90 seconds, with a 3D image of the lungs produced immediately afterwards. In summary, the CHI Memorial Community Health Clinic is an integral community member that works to increase the overall health of the community. They serve to increase access by removing financial and insurance barriers to care. And the mobile screenings increase the overall number of screenings, which then promotes health through that early disease detection. Thank you for your time and allowing me to share, and wasn't paying attention, but it looks like we should have a few remaining minutes. So I will be happy to answer any of the questions that you might have.
Thank you, Dr. Moro. That was an excellent presentation and overview of what services are provided there at CHI. So, and I think a lot of our community partners who provide this type of service would say they do a lot of the same things in partnering with Project Access and using the other resources that are available. Any questions? I don't see any hands up. And other than a thank you, very informative. Another thank you. I do not see any questions.
Thank you.
Thank you, Dr.
Well,
Moro.
I guess
okay.
one small question, sorry. Same thing, I guess, if there are providers in other areas, is there any major thing that you would want them to know about the clinic, or who to refer to the clinic?
Right. I think just increasing awareness. I think we're kind of that hidden secret that we don't, there's not a whole lot of publicity and attention as far as knowing that we're there. So just being aware. But yes, if you have an uninsured patient or underinsured patient, we're a good resource, and knowing that we have Spanish speaking assistants as well. But yes, they do need to be a Hamilton County resident, but those that are uninsured, we have lots of resources and community resources that we connect them through, especially Project Access. So.
Okay, yeah, I still nothing in chat. And oh, okay, here's a question. What is the number if you want to reach out to Memorial to have the lung or the mammogram bust at your site or community?
Okay, I think it's the same number. When I was looking at, as far as scheduling the lung coach, I think it was the 495-4040 for the mammogram. And then it was, I may have to go back and see the number for the, but I know their website, the CHI Memorial website, when you go under services and that lung center, the buzz standifer, it had information as far as how to register for one. They have the patient application forms for both the mammogram and lung coach. You don't have to have an appointment for either of them, but they do recommend it. And it's helpful if you have already filled out the forms, which are on their site. But the phone number is the 423-495-LUNG to register. And I believe that's the same phone number for requesting the coach. And then I was just going to confirm the number for that I told you correctly, if I had it on here, or maybe I didn't. It was 4040. I think I remember the breast cancer, because if you think of the age 40 with annual mammograms, it's 4040 for the mobile mammogram bus, 495-4040.
And I'm putting that in. Oh, Farron's putting it in the chat too. You're getting duplicates here. 4040 for mammogram.
Oh, okay, yes.
All right, awesome. Is the patient clinic relationship, oops, I just lost it. So Farron just typed in the phone numbers. And then we have a question: is the patient-clinic relationship encouraged to be long-term, like a primary care office, or is it more of a transitional role? That's a good question.
That is a good question. No, we're definitely, I probably didn't explain that very well. We are a primary care office for sure. So we have long-term relationships we hope to maintain. And we have several patients that have moved from, we were formerly in West Side, and I meant to say we were formerly referred to as North Shore Clinic. So we have patients that go back with us for at least 15 years. Haven't burnt those bridges yet.
Yeah. Okay, I don't see any other questions. I don't see other hand raises. All right, thank you so much, Dr. Morrow, for this information. Great information, great presentation. Appreciate your time this morning.
Glad to share.
Yeah, okay, our next presenters is going to be Sandy Grove Matheson. She's the Development Officer at the Primary Healthcare Centers of Georgia. We are very glad to have you here with us this morning.